Good morning, everyone, and welcome to this decision session of mine on health, wellbeing and adult social care. I'll just start with agenda item 1, which is declarations of interest. Does anyone have any declarations of interest that they need to make? Oh. Lovely to hear myself back. It's okay, don't worry. No declarations of interest, in which case it would just move on to agenda item 2, which is the minutes of the last decision session, which took place on the 15th of November. And I just wanted to draw people's attention to the minutes and item 9 of the minutes, which was a correction which did take place in the meeting. There's no amendment to the minutes to make. I just wanted to draw people's attention to it, that the Director of Public Health in the minutes on the 15th of November did note a correction in the written report on paragraph 1 and 18, which was about the funding of the scheme via one-off growth money for the 23-24 budget, and that the money otherwise had come from the public health reserves. I just wanted to make sure that was clear, that it was clarified in the meeting. The minutes are correct, but it wasn't correct in the original written report. And then just moving on to do I need to, I can approve and sign those minutes, which I will do at the end of this session. And I will move on to agenda item 3, which is public participation. I'm very excited that we have a public participant for the session today. Welcome, Denise. You will have 3 minutes to address the meeting. I'll give you a warning when you've got 30 seconds left. Thank you.
Thank you very much. I'm here today to present a petition signed by 139 residents calling for the current 9 a.m. to 6 p.m. opening hours of museum gardens to be extended. I sent you a copy of the petition yesterday, Councillor Cole, mainly so you might have a chance to read some of the many comments, which are interesting. But just for clarity, the petition says, we, the undersigned, call on City of York Council and York Museums Trust to find a way of extending the opening times of museum gardens to enable access to and through the gardens from earlier in the morning until later in the evening, particularly in the summer months, if necessary, working with city partners. The petition is signed mostly by York residents, with a very few from outside the city, about 4 or 5. Many are city centre and edge of city centre residents from the Marygate area, Bootham, Clifton, from the Groves, Wigginton and Haxby Road areas, from Monkgate, Fishergate, Hull Road, Micklegate, Holgate and Acombe postcodes, as well as some from a bit further afield. All agree that the museum gardens is a major asset for the city, and there will be huge benefits from being able to access the gardens earlier in the morning, before work and on the way to work, and as a safe, unpolluted walking route to school, and after work in the evenings for exercise, socialising and relaxation. The health and well-being benefits of free access to beautiful green open spaces are very well documented, and promoting well-being and preventative health are, I think, part of your corporate priorities. The gardens are also a subject of civic pride as a beautiful part of our city that helps support the city centre economy. Finding the gates closed at 6 p.m, even on light summer evenings, isn't good for either residents or visitors. We appreciate there are practical issues to resolve here, and we don't take them lightly. Both the Council and York Museums Trust face significant financial challenges. We'd also like to make it clear that we are not advocating for the existing gardening team, which we understand is also responsible for opening and closing the gardens, to be required to work longer shifts. Other solutions need to be found, and we would suggest that this is a whole city issue and should involve a problem-solving approach with city partners in order to achieve a positive outcome. So it really crosses portfolios and everything. We've also sent this petition to York Museums Trust, making it clear how much we support and value the work they do generally, and specifically through curating museum gardens. We hope this issue can be approached as an opportunity to work together with city partners and different council departments to improve access to this very important and valued part of the city centre. Thank you.
Great, thank you so much, and thank you for your contribution. Thank you, which will be taken into consideration. I will actually take it away, and my next meeting with the Yorkshire Museums Trust, I'll ask them about it and see if we can get back to you more formally as well. But thank you for your contribution this morning. I'll move on to agenda item 4, which is the York Learning Self-Assessment Report for 2022-23. Thank you to Angela Padfield, the Head of Adult Learning, and Paul Cliff, the Head of Service for Adult Learning for York and North Yorkshire, for joining us. If I could just ask both of you if you had any brief remarks you wanted to make about the report, and then I had a couple of questions I was going to ask you afterwards.
Thank you. So I just wanted to confirm how this comes into being, if you like. So each department, each curriculum area, so that's visual performing arts, languages, English, maths, apprenticeships, and so on, they all create their own report based on their area and the quality of it. We then merge that into the report that you see, which is then challenged by our governance board, who overview what data and what information they've heard over the year as to whether that's an accurate report, looking at the data. It then goes to a group of regional adult education providers who all also then pick it apart and decide whether or not it's a good reflection of what we're doing. And then it comes to you as that final sign-off before we send it to Ofsted next week. So I just wanted to clarify that. We've had some problems with achievement last year, with relating mainly to retention of learners. Sometimes it's attendance, sometimes it's retention, because of a variety of reasons, but the most predominant reason that we've had is to do with health and well-being, and that people are struggling in general, they're struggling financially. If they've had to take on extra work and extra shifts, they've not been able to attend as regularly as they needed to. Sometimes that's too much pressure and they've fallen out altogether. Health issues at home, additional caring responsibilities, and for some children that don't want to go to school, the parents have had those issues to deal with, and it's just all been too much to look after their own education as well. So there's been a variety of issues why our achievement has been lower in that period, and we're working hard to make that better this year. And I thought I'd just sort of encapsulate it there, if you like. I know you've got quite a few questions. Do you want me to leave it there?
If you want to leave it there, Paul, did you want to add anything?
Nothing specific there.
In which case, thank you for that. And thank you to all the staff who I know work really hard across the city to support this work, and people, adults who are kind of taking forward their learning later on in life. It is a time of year, January, when people start to look at new ways of self-improvement and further education. So this, you know, it is particularly timely that we're looking at this report at the moment. I absolutely hear you on the challenges facing residents in completing courses of learning, particularly when it's down to either their own health and well-being or that of a family member, or cost of living pressures that might mean that they've had to take on additional work, which might make completing courses of learning more challenging. I just wondered whether there was anything more you can say about how we can support people to complete their courses of learning, around the flexibility of courses and those kind of things. I completely hear the pressures that people are under, and I assume that applies to those delivering the courses as much as it applies to those taking the courses. So I hear that, but just really, if there's anything you can say about ways that we can support learners to be flexible, I guess, in how we deliver things to enable people to complete those courses they clearly want to complete, but for whatever reason end up having to drop out of them.
Thank you. So back last January, we started, one of our managers, the counselling manager, started a mental health sort of advocacy role, a qualification about how we can introduce better wellbeing support to learners and our teams within our service. So we've had that piece of work ongoing, and part of that has been to talk about exam anxiety in class, actually more targeted questioning around wellbeing in general in class and on the paperwork that we create to help create those conversations more often so that tutors are more aware of what's going on. It's not that they're not aware, but it's making the learners more comfortable to talk about it so that we can help provide that additional support. There's been a lot of additional support gone on over the last 2 years to learners before and after sessions to help them catch up and so on. But for some, it has been even more problematic. So we are even starting to look at a in-house counselling service, which some of our students will start to provide. We're still a way away from that, but that is also part of the recognition. We've got a social prescription model, which if some need to build confidence again or to take a step back, we've introduced breaks in learning. We have more in-depth conversations at the beginning as to whether they're ready to start learning, what's going on in their life, what are the barriers. Maybe they should come back when they're ready, because we start all year. They can start later in the year. If they thought they could only enroll in September, they're wrong. They can start in January, they can start in March. We have, some courses you can start any time of the year. So we don't want that for them to push themselves to start then when they're not actually ready as well. So there's been some of that going on. And just really making the conversation around well-being much more present in class so that people feel able to talk about it, because talking helps a great deal, especially if a problem shared is a problem halved, isn't it? And that seems to come across from a lot of the classrooms at the moment. So at this point, attendance is good. Retention is over 90%. So we're in a good place at the moment. It's as we get closer to exams and that creates its own tension that we may see that drop off. And that's what we're working hard at the moment to anticipate, if you like, and do the exam anxiety sort of training that we're doing at the moment. We've also created a readiness for learning course, which the counselling students tested in December. So they're not students yet. They come for an information night, and then we've put them in the readiness for learning. And that's just about what you need, how do you equip yourself for the course? How do you need to be prepared for it? What time do you need to put aside for it? And all of that, and try and sort of bring all that together to help them understand where they're going and what they need to do and whether they're in the right place, and have a chat with us about that if they're not, and take it from there. Because maybe some are better off doing something around just building up their writing skills or their confidence levels, social inclusion and all of that before they start that course. So all of that seems to have gone well as well, and helping to support. So we're still working on it. We still have some issues, but overall it's looking in a lot more positive light. But we're not at the most challenging part of our academic year yet, and that will be telling as to whether we've got it right or whether there's more to do. And I'm sure there will be more to do, because there always is, isn't there?
I'm going to say yes, there's always more that we can do, but I appreciate all the work and thought that is going into particularly how we kind of break down perceptions of barriers, even if they're not real barriers, to kind of gaining those qualifications at the end and people's kind of satisfaction that they would have at reaching that point. But it can sometimes feel very difficult when there's a lot of other things going on for people. So I appreciate all the efforts that you and the team are making to think about how we might break those down. Paul, did you want to come in?
Yeah, I think the other thing that we're doing is we've secured some money through the Learning Skills Improvement Fund to allow accessibility to programs on a improved basis. So that opportunity where somebody might be struggling to finish work, get home, make sure everybody's sorted at home, and then go out again to learn has been a barrier. But we've got significant investment through the Learning Skills Improvement Fund to improve hybrid learning opportunities, so that we're able to utilize digital technology so that people can feel like they're still part of the class without being part of the class. So we'll be trialing some of that. So that addresses that practical element that is also part of that sort of barrier. But I do think that sort of investment in the additional support that we've ramped up over the last 2 years has made a significant difference, and will continue to make a significant difference as we move forward. But the combination of all of those factors should start to address some of these. There are some aspects of this that we can do little about, so there's the identification in the report, learners who come on particularly ESOL programs, who are here because this is where they are placed and then they are moved out of the city, that we can't do anything about that. So we're always going to be in comparison to a physical building and a 16 to 18 learner in a college. It's always going to be more difficult for us to hit those higher figures, but we're doing as much as we can. Some of that significant work in terms of mental health will start to do that, as well as the additional support elements that we do already.
Great. And the only other thing I wanted to ask you about was only because it's come up for me in Chapelfield, actually, in Westfield, was just anything you could add to me about the digital bite-size courses and the age ranges that those are available to, because it certainly strikes me that those are courses that should be available to all ages, and particularly people who might be nervous about the digital kind of space. And actually those bite-sized courses being a really important part of breaking down the mystery of online digital skills and learning, and what is and isn't okay online and those kind of things. It's certainly come up for me with talking to residents in Chapelfield that is something that they are worried about and would welcome access to. So just whether you can say anything about that, particularly in view of age ranges and it not being something that is just for younger people. It's actually really important for other people. So,
Of course, we have a wide offer in digital skills and digital bite size, which is open to anyone who's 19 plus. We can't go below 19 plus because our funding doesn't cover that. But anybody who's 19 plus is entitled to a free course in digital skills. We do it via community learning or via accredited learning, which depending on what their needs are. So you'll find those who are looking for work are more likely to want to do accredited learning, and those who want to do it to improve their personal life safety, if you like, their security online and all of that, they tend to do more the non-accredited route. We're working really closely with Digital Friendly York to provide a bite-sized list. There's like 8 or 9 courses that any group, any charity, any local communal place can call us in, and they can pick so many items from that menu for us to deliver. We're also going to be delivering at the place. I believe that's being organised at the moment as a digital menu process as well. We've been in the Gateway Cafe and a few other places up there, and I believe it's getting spread out across the city. We're also developing a programme with Haxby Surgery, where people can understand how to access their NHS app, to book appointments, how to get their repeat prescriptions, how to do all of those sort of things. So we're engaging with that, because ultimately any digital skill will support other digital skills. And so if they can access this app, they'll be able to access another app and so on. And the things to look for on a browser, so that it's got a padlock and it's, you know, have you checked, if you look for reviews on this company, have you done this, have you done that? So all of that is wrapped up within that. It's sort of part of our online safety, be safe online sort of offer, if you like, as well as just getting to know your laptop, social media, all sorts of things, and right through the English and Maths offer is all reflected within there. In fact, right across most of the offer, there's talk about how to be safe online, what to look out for, and they certainly get challenged when they're going online to think about these things and to check this and check that. So we try to incorporate it throughout the offer, but it's open to all. We don't discriminate against any ages when it comes to people's digital safety. We take that very seriously.
quite right too. Thank you very much. I'm very happy to welcome the report. Is that what I have to do? Yeah, go on.
I've just got one thing I should have done for the record. The data has changed just slightly since I submitted the report. We'd said that it was 74.1%. It's actually changed. The data came in last Thursday and it's changed to 72.2% overall. That's on page 3 of 7 under adult learning programs. And then in the SAR itself, under impact, achievement has changed from 74.1% to 72.2%, and the pass rate changed from 84.7% to 91.8%. No, 91.8% to 84.7%, and retention has increased from 80.7% to 83.5%, and that's in the 19 plus education and learning area. Apprenticeships have stayed the same. but headline information for 16 to 19 information, education on pages 5 to 7, achievement has increased slightly from 70.4% to 70.8%, and retention has increased again from 83.1% to 83.5%.
Great, thank you. Yes, I've made a note of those changes, and actually that they're going in the right direction, which is really good news. So thank you for that, and thank you for all the additional comments about retention levels in particular and how we can support learners to complete. And we are out there competing with other employers sometimes who may not offer the same kinds of accredited learning, but might pay a slightly higher hourly rate. And in the current environment of cost of living pressures on family budgets, it is a shame, but nevertheless understandable that those people make those choices to take a higher salary immediately over some learning that might pay dividends in the longer term, but might not in the short term. So those are challenges for you going forward, but thank you for the report. I'm very happy to welcome it. And to enable you to send it off to Ofsted, which I know you need to do next week. So thank you for that. I am not aware of any other urgent business that I've been notified of. So on that basis, I'm happy to adopt the report and to close the meeting. Thank you.